biomedical treatments. You can do hormone replacement. You can do oral. You can do implants, transdermal, topical. So oral, again, there have been 3 major studies that I remember implicating oral hormone replacement therapy with increases in cardiovascular risk and cancer risk. And the immediate knee-jerk reaction was to blame that on estrogen. Well, after looking and parsing through the actual research, many researchers changed their opinion and felt that the problem was synthetic progestins, okay? So you'll often hear a doctor say, well, we're going to give you estrogen and progesterone. Well, often that's not actually the case. If you look at the pill, and this is true with the pill, with birth control pills, they rarely give progesterone. They give estrogen and progestins, which are synthetic. And the reason they do that is because progesterone is a naturally occurring substance, and it cannot be patented. So they need something that can be patented. So they use the progestins. And those seem to be, in many studies, where the majority of the problem arises. Now, I get asked the question very frequently, what about bioidentical hormones? So bioidentical hormones, you would usually get from a compounding pharmacy, and it would use the form of estrogen that human females have and produce, and it would use real progesterone. And there's very, very little increase in danger if one gets bioidentical, true bioidentical hormone replacement. And there are lots of benefits of that, which I'll get into. So that is a possibility. If my patients talk to me about that, I'll say, yeah, that's, you're weighing a slight increase in risk versus a huge difference in your quality of life. So, but I'm firmly against using artificial oral hormone replacement. Now, you can also get implants, and these are done for birth control, but they are also can be done for hormone replacement postmenopausally. Now, most of the medical plans will not cover this, and you'd have to go to a functional medical doctor or a naturopath or someone that would do this for you. And there, the hormone pills or I don't know what to call them, actually. I'm going to call it a pill for now, is actually injected under your skin, and they're implanted, and they last for several months. And the advantage of those is that you get a very, very constant release of the hormones. So if you're doing an oral tablet, your level of hormones is going to go up and down over every 24 hours. And that's not quite as safe as if you're at a very constant level. Now, this is even more true and valid for men doing testosterone. Implanted is much safer than oral. So you could do an implant, or you can do transdermal. Now, this is usually done with progesterone. And progesterone deficiency is very underrated as one of the significant causes of menopausal symptoms. We always look to the estrogen, and the estrogen is certainly significant, but sometimes transdermal, or a lotion, basically a cream applied to the skin, transdermal, can get rid of most of the symptoms. And topical, I'm opposing to transdermal in that the topical is generally a vaginal cream, sometimes a suppository that delivers a small dose of hormones directly to the tissue in the vagina. One of my all-time favorite drugs, because I can find almost no increased risk. There's a slight increased risk in women who have a history of breast cancer, but there doesn't seem to be any increased risk otherwise. Now, again, check it out for yourself because there's new studies every day. But the difference in quality of life from doing topical vaginal estrogen is incredibly dramatic. I mean, it's very dramatic. I have several patients in their 60s who've come in, females, complaining that they have constant urinary tract infections, but when they're tested, they can't find any bugs. Typically, the problem is that over time, as the vaginal tissue it starts to lose its plumpness, which it will with estrogen, and it shrinks and it gets friable or breaks easily. It's just really, like having very, very dry skin on your hand or your arm. And then the urethra, the small tube that the urine goes through, doesn't have the same type of tissue. So it remains extending down below the level of the vaginal tissue. And since it's not supported at that point, it can get a little like a J hook in it. And then when a woman urinates, a little bit of urine will stay in that little J hook, and eventually it will burn like heck, and it'll feel like a urinary tract infection. And doing a topical estrogen cream can completely, or almost completely, I rarely say completely, right? Because there's always an exception, but I have never seen an exception. It can almost always relieve any risk associated with vaginal dryness. And then medical doctors, I think, are way too quick to give antidepressants and anti-anxiolytics. That's not the problem. The problem is the low hormones. So I think it's safer to treat the hormones directly than to give antidepressants and anti-anxiety drugs.